Hello, everyone. Thank you for tuning into our Facebook Live event. Natasha here presenting today. We've got a lot of things packed in for you today. We have Ketan, who will be speaking about eye health, and also Synergy joining us on a dance move. You can't see it. So please feel free to stay tuned and enjoy the event. I'm going to pass over to Ketan, who is on Zoom. So bear with me one moment.
Hi guys.
All right, Ketan, let me just see if you're on live. Can we all see Ketan today? I believe we're all good. All right, Ketan, when you're ready.
Okay. Hi guys, my name's Ketan Jadeja. I'm one of the optometrists working at Moorfields Eye Hospital and also in the community at Day Lewis the Opticians. I'm also one of the trustees at Croydon Vision, so I work very closely with Croydon Vision. I'm also part of the glaucoma support group. I've got a list of about 12 questions that I've got from members, which I'm going to go through now. If there are any other questions, then please feel free to let me know. All right. So the first question was to do with eye drops. If someone is totally blind, do you have any tips when putting the eye drops in? So obviously, this can be quite tricky. It gets better with practice and with time. Firstly, you can get these drop aids, which you can get from the GP, the pharmacy, or actually directly from the manufacturer at no cost. The drop aids, you put the bottle in the drop aid, and you can squeeze that to put the drop into the eye. The main thing for putting the drops in, obviously, practice makes perfect. But what I normally suggest is that you sit on a chair, put your head right back, pull your lower lid right down, see a large area, so a large target for the drop. So with one hand lower lid down, the other hand with the drop, and you drop it in as close as you can to the eye. Let go. Straight away you close the eye and you keep the eye closed for at least 1 minute. You put your finger in the corner here at the same time to close your tear duct to stop any drops from escaping. So the main thing really is a large target for the drops, a lower lid right down, get as close as possible to the eye, drop it in, straight away close the eye and finger in the corner. Secondly, question was, if someone is registered blind, is there any point in going to see the optician for checkups? People can be blind in many different ways, depending on their eye condition. For example, if you have macular degeneration, this affects the central part of the vision. Whereas if you have glaucoma, for example, this affects your peripheral vision. So most people are not totally, completely, 100% blind. They still have some sort of vision centrally or peripherally, which they use. And that's why it's very, very important, at least once a year, to go for an eye health checkup to rule out any other eye problems which could damage that little vision that you do have further. For example, if you do have macular degeneration, so very, very poor central vision, you can still develop glaucoma, which might affect your peripheral vision as well, leading to complete blindness. So that's why it's very important once a year, see the optician and they rule out any other eye problems for you. The third question was, if a grandparent has glaucoma, is it important for the grandchild to get checked once a year or once every 2 years? So as we know with glaucoma, there's a very, very strong genetic link with glaucoma, in particular the first degree relatives. So if you have a parent or sibling with glaucoma, they're more at risk to develop glaucoma. In particular, a sibling with glaucoma is much higher risk for you to develop the condition. Grandparent to grandchild is not as much of a risk, but it's still in the genes. So once every 2 years for that should be fine, but once every year for a first degree relative, so parent or sibling. Question number 4 was, I cannot see at all, but I've been told that I should wear sunglasses or glasses to filter out the blue light from screens. Is that correct? So we know that blue light can be quite damaging to the eye, to all structures in the eye, from the cornea, the outer part of the eye, to the lens, causing cataract, and also to the retina, in particular the macula. So the blue light can cause further damage to the macula and can make things like macular degeneration or other macular conditions worse, which is why people are normally told to try to reduce the exposure to blue light. So they can get these certain filters in front of their screen, or wear sunglasses outside as well to protect their eyes from the UV. Also, if you have certain eye conditions and you're very sensitive to light as well, sunglasses will be needed for that purpose as well. Question number 5. Yes.
Sorry, I have a question that's come through just in relation to Drop Aid. The question is Drop Aid available by all eye drop manufacturers?
So most manufacturers, yes, they have a specific Drop Aid specific to their bottle. So you can contact them directly or speak to your pharmacy or GP, or you can get these generic Drop Aids as well, which tend to fit quite a large number of bottles. I know that Moorfields, London, do a large range of Drop Aids as well, so they can be contacted as well. But yes, they do specific drops by the manufacturer or a generic one as well.
Brilliant, thank you, Ketan.
Question number 5 was, I have nystagmus. Is there a way of checking my eye pressure? So obviously with nystagmus, which is when the eyes are moving constantly, checking the eye pressure can be quite challenging at times, but it's not impossible. We can still check eye pressure. So within the hospital, we use the Goldman tonometer, which is with drops to numb the eye first, and then we very gently we touch the eye surface to check the pressure. This works well in most people. Now, people with a nystagmus, with their moving eyes, normally they have a point called the null point, which is the direction of eyes where the movement is least. So let's say the movement is least towards the left. So they can look towards that in that direction. There'll be less wobbling of the eye, and it'll be much easier to check the pressure that way as well. We do have a handheld version as well called the iCare, which is similar to a puff machine, but it's a bit more accurate, and that can be used as well to check the eye pressure in patients with nystagmus. So there are a good 2 options there. Question number 6. Has the way that opticians make referrals to Moorfields changed during this time? Yes, so during the current COVID-19 pandemic, opticians' referrals into the eye hospital have changed drastically nationally across the board. So at the moment, all patients have a telephone stroke video consultation first by the optometrist, and then only if required, they can see them face-to-face in practice, or they can refer them via email to Moorfields. Now, the referral still goes through to Moorfields in Croydon. All routine referrals nationally have been put back at least 3 to 6 months because they're deemed low risk. And at the moment, the hospitals are only dealing with high risk, urgent, sight-threatening conditions, face-to-face or surgery. So even surgery that's routine, like cataracts and that, have all been postponed by 3 to 6 months. So if patients need to be seen urgently for face-to-face checkup or surgery, they're all being diverted to St. George's. So we send the referral to the same email address to Croydon, and the same doctors that see it at Croydon now see it at St. George's, which is where they're based, and they check the referral, and they can do a telephone video consult with a patient, and then they can get them booked in. Question number 7 was...
Sorry, Ketan, I've just
Yes.
had another question that's come through.
Yeah.
So when removing cataracts, what is the chance of damaging the back of the eye? I have RP, retinitis pigmentosa, and my retina is in good condition.
Yeah. So with cataract surgery, the overall risk, they say, in the UK is there's 1 in 1,000 chance of permanent damage to the eyesight through bleeding or infection or other types of complication. It's not that common, but 1 in 1,000, there's still a small risk there. That's why they'll only really do cataract surgery if they really, really need to. Obviously, there can be other complications. For example, it can cause a fluid accumulation in the macula, which can affect the vision as well. It can cause other changes to the retina as well. So if you have any retinal changes, any thinning of the retina, then there's a chance of retinal tear or retinal detachment as well, albeit not very common, but the risk is still there theoretically. But normally, yes, the facts say about 1 in 1,000 risk of permanent visual loss. So let's only do it really only if it's really, really required and it's going to be of great benefit in the long run.
Brilliant, thank you.
Question number 7. Would you refer someone who needs to be taught the eccentric viewing? So eccentric viewing is people that have poor central vision, for example, macular degeneration. They have poor central vision, but they have good peripheral vision. So they need to look to the side of the object to see clear. So this can be taught by the optometrist, or your doctor or the optometrist can refer you to the low vision clinic, and they can teach you the techniques to use to help you out. Question number 8 was, I've been taking the same eye drops for many years, but recently they've started to sting. Why would this be? So in particular with glaucoma drops, it's every year the manufacturers, they lose their patent. So rather than being a branded drop and just one drop for everyone, now there's many generic versions of that same drop. For example, Xalatan was branded for many, many years, but now there's about 7 or 8 different versions of the generic latanoprost. So it's even they that contain the main ingredient there to lower the pressure. They still have different, slightly different components in those 8 different variation drops. So some might sting more than others, which is why you might get in that sort of stinging sensation. So you can do 2 things. You can either ask your Moorfields doctor or your GP if you can get the branded version of the drop, which they might do or they might not do, depending on their budgets, I'm afraid. Or you can try using some dry eye lubricating drops, say 5 minutes or 10 minutes before putting in your glaucoma drops, which might sting less. That might help as well. All right. If you really can't get on with the drops that you're taking, then please speak to your GP or call up Moorfields, and we can see on what we can do for you as well. Question number 8. Sorry, number 9.
Sorry, Ketan.
Yes.
I just had a kind of follow-up question in relation to what you were discussing. Am I at more risk by having RP when getting cataracts removed?
With RP, because the retina it's already damaged peripherally, and the macula is also damaged as well, there is theoretical more risk, yes, of further damage to the optic nerve and further damage to the macula, yes. If there is significant cataract there, and the benefits will greatly outweigh the risks involved, then the surgeon still might do the cataract. But yes, theoretically, there's a slightly higher chance of complication or further damage with RETPEG, yes.
Thank you.
Question number 9, would you make a referral to the rehab team? Yes, so optometrists can refer to rehab team. Normally, because we all work quite closely with Croydon Vision, normally we do the referral to Croydon Vision, and obviously they have the access and good links to all the local services, so they can point you in the right direction and give you all of the advice that you need to get the referral, and they can also give you advice on rehab and that sort of thing. Your doctor optician can still refer you anyway to the local health team to help you with that as well. 10, how can you best look after your eyes if you're suffering from allergies? Allergies can be either drop related or non-drop related. Regarding drops, the main symptoms of allergy to drops are more of like a red rash sort of the appearance, maybe around the lids or your lower lid in this area here. The eye might be red, swollen, and fairly itchy as well. So if this happens when you're taking a drop, then you'll need to speak to the Moorfields team straight away to see if they can give you a different type of drop. It might be a different class of drop, or it might be a preservative-free drop, which is less likely to give you the reaction. If it's a non-drop related problem with allergy, firstly you need to determine on what's causing the allergies and try to avoid it. Try not to rub the eye, because that makes it 10 times worse. Instead, use a cold compress over the eyes regularly throughout the day to try to relieve those symptoms. Also, you can take the antihistamine tablet regularly throughout the year if need be, and your doctor can prescribe you drops as well to help you with the allergy. Also with that, you can use some dry eye lubricant drops as well to help dilute the allergens and give your eyes a bit more of a symptomatic relief as well. Number 11, do you have an understanding of Charles-Bonnet syndrome? So Charles-Bonnet syndrome is linked with people that have severe visual loss. So if they have very, very poor vision in both eyes, the brain randomly fires signals and it gives the appearance of visual hallucinations. So Charles-Bonnet syndrome are visual hallucinations due to people having very poor vision. So the patients know that the things that they're seeing are not real, which will distinguish it from any mental health problem. So it's more of a cortical reaction to sight loss and people seeing things that aren't actually there. At the moment, there's no cure, I'm afraid, for Charles Bonnet syndrome, but there can be certain techniques that people can use to try to ignore the images that they are seeing. And the last question, number 12, are you doing any virtual appointments with clients? And if you are, can you give us a better idea on what platforms you use to do this? So yes, for the past 3 months, most of our consultations have been a virtual consultation via telephone and via video. So, so initially we call the patient up and we have a full history and symptoms consultation. And then we use either our phone or our smartphone or our laptop software to do a video call with the patient. So the patient for this to work needs a digital device. So either like a smartphone, a tablet, or a laptop. And normally we can either send them a link on the mobile or on the laptop, and they click the link and then we can see them face to face. Or if you don't have a laptop or anything like that, we can use WhatsApp Business as well. So if you have the WhatsApp app downloaded on your smartphone, then we can do a video consult that way as well. That's the end of the questions there. Are there any other questions at all related to my questions, or anything else at all?
Thanks, Ketan. I do have one question that's come through. Please explain more about COS with the new framework with Moorfields Croydon.
Yeah, so the Croydon CCG, so that's the Clinical Commissioning Group. About a year and a half ago, they commissioned just one service and one block contract to Moorfields. And so Moorfields are now running the contract for the eye service in Croydon. And Moorfields have subcontracted out a community service with COS, which is the Croydon the ophthalmology service. So any non-urgent, non-sight threatening conditions can be dealt with in COS first. So you have the initial checkup with a practitioner locally to you. I think there's about 15 practices scattered all around Croydon, so we have good coverage. So they see the optometrist first for a remote or face-to-face consultation, and then the optician will give the advice and a treatment plan, and then if required, then they can refer routinely or urgently to Moorfields Croydon for them to be seen by a consultant if needed.
Brilliant, thank you very much.
Yeah.
Just wait and see if any more questions are going to come through, Ketan. Okay, I think we've got another one. Thanks there. So if I have my cataracts removed, is the chance of damage still 1 in 1,000 when having RP? My RP is not near the retina at the moment.
Okay, so it's based on a case-by-case basis. Because I don't know the full history or have your case notes, I don't know the actual, I can't really give you a definitive answer. What I suggest that you do is, if you can speak to the consultant at Moorfields, who have your full notes, and they'll be able to give you a bit more advice on the on the pros and cons and risk profile in your particular case. Without your case notes, it would actually be quite difficult to give you any further information for that. Sorry.
Thank you, Ketan. And I've got one last question here. I have been using eye drops for some years for dry eyes, but recently I have noticed that the drops are stinging. So am I wondering if I should be concerned about this?
Yeah, so with dry eye drops, people that are using drops for many, many years, you can get a slight reaction to these dry drops because of the preservative in the drop. So what I recommend that you do is speak to the pharmacist to get a preservative-free dry eye drop and use that regularly instead of the normal preserved ones. So the preservative-free ones are much kinder and gentle to the eye surface, and they shouldn't sting either. So yeah, I would say switch to a preservative-free version of the dry eye drop. If you're still having problems, then speak to your to Moorfields doctors, or you can be referred to COS as well.
Thank you, Ketan. And just another one that's come through. I have been having Eylea injections in my eye for AMD. I was supposed to have injections in April, which I could not attend. My next appointment is the end of July. Will my condition worsen as it will be more than 12 weeks? My left eye vision is not good for distance.
Yeah, so at the moment, Croydon Moorfields are only doing the injection clinics only for AMD or any diabetic patients that are quite urgent. If they have postponed it until July, if you're on the lower sort of risk group, then they might be happy for you to be seen in July. So obviously, yes, you're right. Things can get worse during that time. So what I recommend that you do, if there's any sudden changes to your vision in that eye, so any sudden reduced vision, any sudden distortion more than normal of straight lines, or any other sudden changes to the vision in that eye, please call up Moorfields Croydon straight away, and they might get you booked in earlier.
Brilliant. Thanks very much, Ketan. I believe that's it with the questions.
Thank you very much.
So thanks again, Ketan. It's been brilliant having you here on our Facebook Live. Very informative. So please do sit tight. We will switch over to Synergy. So we will be right back. So one moment, everybody, and we'll be with you soon.